how chlamydia can cause infertility in the woman. We shall come to a video that will target the man, but the male. So let's look at the woman now. Even though some of the principles apply to the man, but we'll keep the video short and go straight to the point. So, chlamydia, what is it? Of course, this is an infection, a bacterial infection that is caused by a particular type of bacterium, a particular type of bacteria that is called Chlamydia, trachomatis. Yes, it's a bacterium. It's a type. It's a type of bacteria that cause disease, and primarily being transmitted, through sex, through sexual intercourse. Be it oral sex, like that one involving the mouth, mouth to genital organs, you can transmit chlamydia. Vaginal sex, like the one that you want to look for pregnancy, it must be vaginal type. And then, like the kind of sex that has to do with anus, anal. People try a lot of things out there, and now we are informing you that you can contract chlamydia through oral sex, through vaginal sex, and also through anal sex. Now, how does it cause infertility? Ladies, I am drawing your attention to the fact that this is one monster. Chlamydia is one of the disease conditions whose complication is infertility. And the lady may visit from one hospital to the other, from one traditional doctor to the other, and any other thing, and end up not being able to get pregnant or carry a pregnancy. So we will look at infertility here, not just as inability to get pregnant. We involve even situations where pregnancy could come in, but end in shambles, end in a bad way, and cannot develop to term, and you cannot finally have baby, because we have situations of recurrent abortions. That the person can say that to get pregnant to me is not difficult, but each time I get pregnant, it passes. Each time I get pregnant, it passes. Some may tell you that it took me long to get pregnant, and when I got pregnant, I had now but ectopic pregnancy. Please listen. All of these things that will make you not be able to have children of your own. Chlamydia is one of such hidden monsters. Now, before I end this video, I will also draw your attention to the fact that there are different types of laboratory examination, laboratory tests to determine if you have chlamydia. I am not a laboratory technician, but as a doctor, I've sent people to the lab. And sometimes I need to specify, I need chlamydia IgG. I need chlamydia IgM. The laboratory technicians will tell you the different types of tests, and they may tell you that in Cameroon here, one, if it's IgG, it's an expensive test, a bit expensive, maybe 8,000, 10,000, it depends the institution. But now they may tell you IgM, they can use this strip and it could be 2,500, 3,000 or something. Be careful when you go to do pregnancy, chlamydia tests, I beg your pardon. You may go to a health center and they pick a strip. There are other methods that you will not need but strip. And those ones in your health center, you may just be paying your 2,000 or 3,000 or something about that. Yet, it may show negative. Whereas if the other type is done, I just leave it at that level so that even a layman can understand me that don't just go to hospital and do any common test and say, no, we have done chlamydia. No, many times we have done chlamydia. But be careful, the type of chlamydia test that they have done, it may show negative, whereas if they do the other type, it may show positive. To the best of my knowledge, one is a long-term kind of thing, chlamydia, that it would dictate. And one will not even detect the long-standing type. It may detect an immediate infection. Laboratory technicians will explain this better, but I thought it was targeting this disease. Someday I will target syphilis. So we begin to open our heads and understand some of this, how to target and manage some of these disease conditions. Now, how does chlamydia, cause infertility? If not treated, if not properly treated, if not, handled early, chlamydia can cause complications. One, chlamydia can damage, the reproductive organs, right from your womb to fallopian tubes. Especially like in women, talk about women, it can spread through the uterus to the fallopian tubes, and cause what they call PID. PID is pelvic inflammatory disease. And so that kind of disease where women will be complaining of, oh, my underbelly, lower abdominal pain, waist pain, and then even sometimes pains, generalized pains that come around the pelvic region. A lot, is because of a PID, pelvic inflammatory disease. Okay, number 3, it can cause, pain through inflammatory process. This pain, when the chlamydia eats through your tubes or through the organ, it may cause some degree of swelling. Therefore, the tissues are sick. When they swell, they cannot function very well. Instead, they produce pain, needing treatment. Number 4, they can cause infertility by blocking the tube. Simple. A lot of ladies have had their tube blocked, and they start going to do what I call hysterosalpingography, where a radio-opaque substance is pumped into the system of the woman through the vagina, through the womb, and if it can go through the tubes and enter into the abdominal cavity, they now can do an X-ray of that area. Then when you look at that film of X-ray, you find a white trace of line going through the tube to the end. Tells you that the fallopian tubes are open. That's why this substance could go through. But if they pump it and the substance go and hook halfway, they force it to hook. Then they do this X-ray, and then it shows now a white line going and end halfway. You don't know why it continues, proving that the tubes are blocked. Sometimes it may be one tube that is blocked, and you see the other one went through, the other one blocked, or it may be both. The blockage could happen proximal to the uterus, that is closer. It could happen in the fallopian tube, but closer to the uterus, or it could be distal, very far towards the end of the fallopian tube. It's also very important to determine the area of blockage, because it will also determine if they can do hydrotubation, to blow the tubes, open them and clear them. Yes, and they check into all of that, and they can clear the tube. Number 5, chlamydia can cause ectopic pregnancy through forming adhesions. Most of the time, the tube is not blocked, but there are certain adhesions from upper wall to down wall that seem to cause some cobwebs, that sperm cells could swim past through it. But an egg cell, if it's fertilized, may come and hook there because they like form a mesh trying to block the tube, but the tube is not completely blocked. We call them adhesions. When such a lady gets pregnant, in fact, if the ovum gets fertilized, the fertilized ovum, in trying to pass to locate the womb, may be obstructed there. The transportation, the movement may be obstructed in the tube. And it will stay there and develop chorionic villi and implant there. And when it implants on the fallopian tube, it means it has implanted outside the uterine cavity. That is called an ectopic pregnancy. And now in the tube, we say it's a tubal pregnancy. What will we do about it? They will only need to treat it. If it has not yet descended to rupture or to break the fallopian tube, good. Even drugs can be used, like methotrexate. The doctors will know about it. Please, as soon as I start feeling such unilateral pain, one side in the lower abdomen, which begins to aggravate, which begins to increase with time, do not take painkillers, else you will shield the pain while the thing begins to eat you up. Quickly rush to the hospital, because the sign is what will help them dictate it. If they dictate it when it has not yet ruptured, even drugs can be used to cure it. Even though a lot of people believe that once they say ectopic pregnancy, it is only operation. No, it's not in every case that it can be treated only by operation. You can be operating when it has already ruptured and it is bleeding internally. All right, number 6, there's recurrent abortions. Okay, just like I mentioned, chlamydia can be responsible. That the womb is sick, cannot hold a pregnancy. Each time when it struggles to implant, it may not develop. It will give way. And the cause may just be chlamydia. Now, number 7, it may even cause premature delivery. Some women normally carry their pregnancy to maybe 30 weeks, 32 weeks. By the time it's 34, 35 weeks, baby is out. When she has not yet reached 37 weeks, she has not yet reached term. Sometimes this happens repeatedly. These premature or preterm deliveries may be because of chlamydia. And you find people crying up and down, oh, it's a witchcraft, witches and wizards are in our family. The witch or the wizard now is that chlamydia. Please be careful. Number 8, we are told that even when some women succeed to take pregnancy to term, they may deliver and baby dies within few days or weeks, and still because of chlamydia. And such babies are born with you may see infected eyes, discharging eyes, and then or born with pneumonia. I just see a newborn baby born with pneumonia, and then the people in my village will say side pain. Yes, rush to hospital. In fact, if it was discovered immediately, unfortunately, most of these they deliver at the hospital. They quickly rush to the house within 1 day, 2 days, and in the next 3, 4, 5 days, baby is sick. That baby was born with that thing. Baby contracted the thing from the system of the mother. But then, it was not diagnosed early. You could lose the baby. You can end up living without children, whereas you might truly be fertile. But chlamydia could be the problem. Now, number 9, dyspareunia. That's painful sexual intercourse is one of the complications of chlamydia. That just getting it painful may already be proof that the reproductive system is not healthy. If you start having only dyspareunia, painful sex, please, is that not indicative enough to quickly rush to hospital? The earlier the better, because you are preventing complications that could come in and may end with infertility. May end with what? May end with infertility. So, please, if you like our video, please subscribe, like, and share. Like I said, I am in Bamenda, Cameroon. Make your comments in the comment section, or you write. You have the right to talk with me one-on-one. You can talk on WhatsApp by just writing a message or voicemail. No calls. The numbers 694-353141. If you are not in Cameroon, always start with +237. Thank you. God bless you.